Munira Wilson.
Thank you, Madam Deputy Speaker. I'd like to just dig in a bit deeper into the supply question. I had the privilege of visiting a GP surgery in my constituency on Friday, where I was told by the doctor in charge they can't book the next set of appointments because they don't know when they get the next delivery of vaccine. I've heard from other centres that they're not allowed to move on to the next cohort when they finish their under-80s because of making sure there's equity across the country. And the Minister has said we can't have 24/7 vaccination because of supply. So is it the rate at which the product is being manufactured? Is it the rate at which it's being packaged? Is it the rate at which it's being batch tested? Or is it the rate at which it's being distributed around the country that's the supply issue?
Minister.
Thank you very much, Madam Deputy Speaker. The Honourable Lady asks an important question. So in any manufacturing, and especially a new manufacturing process, it is always lumpier at the beginning. There are more challenges. There are a number of tests that both the manufacturer and, of course, the regulator, so the batch testing at the end of the process done by the regulator to make sure that the batches actually meet the very high standards that we have in the United Kingdom. But, of course, that will begin to become much smoother, stabilise, and we have good, clear line of sight through to end of February, hence why we're confident that we can meet the targets of offering a vaccine to the most vulnerable top 4 cohorts on the list of 9 from the JCVI by middle of February. I think it's important for her local GPs, one, to obviously thank them, but also to remember that the central team, which is doing the distribution, at the moment we're running at about 98.5% accuracy. It does mean we've got 1.5% where the deliveries are not as we would like them to be. We will get better at that. As Brigadier Prosser said, this is like standing up a supermarket chain in a month, Madam Deputy Speaker, and then growing it by 20% every couple of weeks. So it will get better. The focus of the central team is to try and give as much time and notice for primary care networks, for GPs like her own, so they can plan ahead and be able to get those cohorts, the full cohorts, in for their appointments, for their jab. Always difficult at the outset, but it gets better by the day and as in the weeks ahead as well.